It's time for Nip Talk.
It's a 411 segment, but it's not plastic surgery. It's a medical 411 about the upcoming flu season. Now, I have to say that I hadn't thought about the flu in at least a couple of years, right? Because of COVID and the pandemic, you didn't hear anything about the flu. And so when I started looking into this topic, and the reason I'm talking about this is a little newspaper called the Katy Trail Weekly asked me to write something, so they wanted to know about the flu.
From Katy, Texas?
Katy Trail.
Oh, okay.
Katy Trail here in Dallas. Yeah,
Okay.
they have like a little newsletter.
Nice.
It's like a paper, and so I wrote an article for them about the flu season. And when I was doing the research on it, I was honestly pretty shocked because, as I said, I didn't hear about the flu during the pandemic, right? Because COVID was such a much bigger deal. But I'm going to ask you guys this, and not to put you on the spot because I don't expect anyone to know this, but if you were to guess, like, what percentage of cases there were in the last 2 years compared to normal? So like in a normal year, it's 100% cases. What do you think in 20 and 21 there was flu-wise? Like what percent?
I think it went up probably.
You think it went up? What do you think, Travis?
I would say it went down just because more people got COVID diagnosis. So I say it went down, maybe 30%.
Yeah, so there was 1% of the
wow.
cases of the flu in 20 and 21.
Sheesh.
I had to read it from multiple sources because I didn't believe it. I was like, there was only 1% of the cases of the flu.
Wow.
Well, and then you start thinking about it, it does make sense, right? Like, what did we do? We stayed at home, worked from home, we wore masks, we were, doing social distancing, not shaking hands. Like, for a while, we were not going out. And those precautions it basically eliminated the flu, like for all intents and purposes. And so the reason I'm talking about this today is, for one, flu season's coming up. October, right, is the beginning of flu season. And a lot of experts are predicting that we're about to get crushed by the flu. And I was like, okay, that's kind of weird. Why is that? Well, a couple reasons. One, everyone is extremely fatigued from the pandemic, right? I mean, think about it. Life is slowly returning to normal. People are not wearing masks as much. And so, we're kind of giving up those things that brought that flu level down to such a low amount.
Yeah.
And then there's one other thing that also potentially could put people at more risk is that when you have a season of the flu, people build up an immunity to it. Actually getting the flu or being around people and maybe being exposed to it but not getting the flu builds up your immunity. Well, we have 2 years now where that didn't happen. And so that's a couple of the reasons that some of the experts are predicting that we could be in trouble this year.
I wonder also if people, since people were so focused on getting COVID vaccines, that they weren't doing flu vaccines.
Skipping flu vaccines, true.
During the past 2 years.
I don't have any data on that, but that's a very smart thing to say, and you're probably exactly right. It's like, I'm going to go get
I
it.
didn't.
Yeah, right.
Because
What did you do? You got the COVID shot and you
Yeah.
skipped the flu shot, right? Well, I bring it up because annually, the flu does account for around 30,000 deaths and about 400,000 hospitalizations a year in the United States, and that's not an insignificant amount. And what's worrisome is we can kind of get a glimpse of how our flu season might be based on Australia, right?
Okay.
Because Australia,
Different season.
right, it's a different season. They're just finishing up their flu season. Well, when you look at Australia, they're getting pummeled right now by the flu. Cases are 5 times as high as they were in a regular flu season. And so, if you were to extrapolate those numbers into the United States, I mean, we have a bigger population. We could be looking at, a really severe season.
Go cray.
And of course, with COVID being a little bit more severe disease, people might just be overlooking it, just like you said. But I wanted to just talk about this because, there are people who are, at risk for getting really sick from the flu, not to mention just getting the flu really kind of crushes your ability to go to work and, do the things that you want to do. And so being a doctor, of course, I want, people to be healthy and, be able to go to work and be able to be around their families. So there are a couple.
This is definitely the year to get a flu shot then.
Yes. So kind of moving into what can we do to get ready for flu season, which I'm sure is the last thing people want to hear, right?
Yeah.
We just came off 2-3 years of this pandemic. Like, no one wants to hear about the next thing. But I mean, that's part of being a responsible adult, I guess, is preparing for the things that could be bad for us, right?
Yeah.
So you hit the nail on the head is, getting the flu shot is a great idea. And right now the CDC is recommending that everyone 6 months or older, with a few exceptions, get the flu shots. And there are people who are considered high risk for complications of the flu that they consider critical to get the flu shot. And those would be people over the age of 65, people who have more severe chronic medical conditions, and also pregnant women, because when you're pregnant, the flu can hit you pretty hard as well.
Yeah.
So I think that getting the flu shot is a very good idea. Now, I always like to, play devil's advocate. I will say that the flu vaccine is usually not as effective as COVID. The COVID vaccines proved for the most part, at least for the early variants, to be, up to like 90% effective. Flu vaccines in a good year about 50% effective, which is, hey, it's better to have a coin toss to get in the flu than a 100% chance, right?
I grew up getting a flu shot every year. So
Right.
it's like, because my mom was a nurse.
Your mom was a nurse,
Yeah,
yeah.
Tarrant County Public Health.
Yeah. Is she she's still in nursing?
No, she retired.
She retired?
Yeah, but I grew up like every year getting
Every
one.
year?
To the point where like back in the day, you could bring the shots home. She was able to
Oh,
bring
really?
vaccines home, like give us all shots.
That's so funny you mentioned that. Like, we do the same thing in our house, but it's Botox. Like, in my fridge, in my
Yeah.
butter dish, I have like little vials of Botox for when my wife wants to get her Botox. But yeah, so anyway, getting the flu vaccine is definitely a good idea. We don't have any numbers on how effective it is this year, but because the flu vaccine in general is not risky, especially if you've had it in the past, like, it is a good idea for sure, and especially if you're considered high risk to get that flu vaccine. And so there's that. And then the other things to kind of fight the flu are some of the things that we have been doing in the past couple years. You think about things like at least social distancing from people who are sick, which we didn't always do in the past prior to COVID, but now we at least have that in our mind that if people are ill, like to stay a little bit away from them. Hand washing, which has really been popular in the last couple of years. If you continue that, that's a good idea. Things like hand sanitizers, and then I hate to say it, but face masks do work. I mean, we learned that from the pandemic that wearing a face mask does cut down on the risk of communicable diseases, especially the flu.
Yeah.
And I'm not saying that we all need to run around with masks on, for the flu, at all.
Yeah,
but
I hope not.
But if you're a person who's a high risk, if you have those chronic diseases, and if we are getting crushed by the flu, like the experts are predicting, then it might not be a bad idea to wear your face mask occasionally, because for sure it does cut down on the transmission of that.
I know. Face masks just don't ever match your outfit, though.
I know, it's hard to look stylish in a face
So,
mask.
I can't do it.
And I like to wear
Not
sunglasses
again.
like all the time, and like when you wear like a face mask and you have glasses on, then your glasses fog up, and I hear you, sister. Like I had to wear it all the time at work, right? I work in the hospital and all the clinics I work at, and like wearing a face mask was definitely not my favorite thing to do. But I know everybody's fatigued with the COVID pandemic, but it is coming. Flu season's just right around the corner. I want people to be aware that they're predicting to be a bad one, and just minor things like washing your hands and staying home if you're sick can make a big difference.
Yeah.
So,
I agree.
excellent.